Today we will be talking about the Stanford University Veteran Health Services. Now look how US health insurance work. Healthcare in the United States can be very expensive. A single doctor's office visit may cost several $100, and every 3-day hospital stay can run tens of thousands of dollars or even more depending on the type of care provided. Most of us could not afford to pay such large sums if we get sick, especially since we don't know when we might become ill or injured or how much we care might need. Health insurance offer way to reduce such costs to more reasonable amounts. Now here's the way it typically works: that the customers you pay and upfront premium to health insurance company, and that payment allows you to share the risk with lots of other people and enrollees who are making similar payments. Since most of the people are healthy most of them our time, the premium dollar paid to the insurance company can be used to cover the expenses of the relatively small number of enrollees who get sick or are injured. Insurance companies, as you can imagine, have studied risk extensively, and their goal is to collect the enough premium to cover medical costs of the enrollees. There are many different types of health insurance plans in the US and many different rules and arrangements regarding care. Now, following are the three important questions you should ask when making a decision about the health insurance that will you work for you best. The one where I can receive the care. And the answer of this question is one way that health insurance plans control their cost is to influence access to providers. Providers include physicians, hospitals, laboratories, pharmacies, and other entities. Many insurance companies contract with a specified network of providers that has agreed to supply services to plan enroll fees at a more favorable pricing. If a provider is not planned network, the insurance company may not pay the services provided or may pay a smaller portion than it would for in network care. This means the enrollee who goes outside of the network for the care may be required to pay such a higher share of the cost. This is an important concept to understand, especially if you are not originally from the local Stanford area. If you have a plan through a parent, for example, and that plan's network is in your hometown, you may not be able to get the care you need in this Stanford area, or you may incur much higher cost to get that care. And the second question is there, what does the plan cover? So answer, one of the thing healthcare reform has done in the USA under the Affordable Care Act is to introduce more standardization to ensure plan benefits. Before such standardization, the benefits of varied drastically from plan to plan. For example, some plans cover prescriptions, others did not. Now, plans in the USA are required to offer a number of essential health benefits, which include emergency services, hospitalization, laboratory tests, monitoring, and newborn care, mental health, and substance abuse treatment, outpatient care, services you receive outside of the hospital, pediatric services including dental and vision care, prescription drugs, prescriptive services, and management of the chronic diseases, rehabilitational services. For our international population of the students who might be considering college, through a non-US based plan. Asking the question what does the plan cover is extremely important. Now the question 3, how much will it cost? Understanding what insurance covers it actually complicated. In our review we talk about the paying a premium and enroll in a plan. This is an upfront cost that is apparent to you now. So the question for our student is to pay a larger or share later. Either way you will pay the cost care received. You have taken approach, then it's better to pay a larger share in the upfront premium to minimize such as possible costs that are incurred at the same time of the service. The reason for our thinking is that we don't want any barrier to care. So there are some important concerns and terms which are listed. So you can now log in and apply for the insurance. Thank you.